Good afternoon, everyone. I'm Shivangi, and I'm delighted to welcome you all on behalf of Whiteboard Education and Research Foundation to the ninth impactful session of the Changemakers of India 2.0 series, a series that celebrates real people creating real change across India. This platform is dedicated to showcasing visionaries who are transforming industries, challenging conventional thinking, and driving positive change for a stronger, healthier, and more inclusive nation. And today, we are joined by two such change makers whose work is redefining healthcare with innovation, empathy, and vision. Please join me in welcoming Dr. Puneet, co founder and CEO of CureSee, a pioneering AI based visionary therapy platform, and medical director at Cure for Eyes, a qualified optometrist, BNYS expert, and proud alumnus of IIM Kozhikode and Amity University. He is also a mentor of change and Shark Tank India success story, whose mission is to make early stage lazy eye treatment accessible and effective through technology, and is co founder and strategic mind behind the business, Mr. Amit Sahni, director at Nanak Pharma and Purecon Lenses Private Limited, who brings strong expertise in pharma and optical industries. Mr. Sahni has played a crucial role in CureSee's growth, combining commercial insights with healthcare innovation. Together, they are using the power of AI to solve one of the most neglected problems of eye care, lazy eye, and in the process, building a solution that is clinically strong, technologically scalable, and socially impactful. Welcome to both of you to the platform.
Thank you so much,
Thank you very much for a lovely intro.
Okay,
especially
so
to Whiteboard Foundation for organizing this session and the entire series.
you're most welcome. So, what was the core problem that inspired you to create CureSee, and why did you choose to focus on lazy eye only? I mean, we haven't heard about such thing very frequently in the medical industry.
Okay,
So
actually,
Uh,
definitely, it's a neglected field.
mhm.
uh, we saw that amblyopia treatment or the lazy eye treatment hadn't evolved since
Hmm.
the Pirates' day. Literally where the eye patch was the thing. So it baffled us, like in the today's world when the AI is there, there's so much evolving around, and why it is still stuck to that era.
Hmm.
So we wanted to find a smarter, screen-friendly solution where patient does not have to go again and again to a clinic. By the way, this was developed in the COVID days. So going to a hospital was, just was taking a risk on your life that days. Like if you want to go to a hospital. So we wanted to something, which kids don't have to come to the hospital every day. And
Hmm.
since there was no evolvement around it, there was nothing new happening. Though we thought, why not touch this and solve this problem first.
That is, really insightful. Solving such a specific need says so much about your purpose and the passion. With one of you from a clinical background and another from pharma and optical businesses, how did your skills complement each other in building the CureSee?
I think of this as yin and yang of eye care. He is the one who diagnoses the problem, and I figure out how to make a solution which can be pitched further, or could be sold, I would say, for commercial angles, and together we see the full picture.
That's really great. That's such a great example of how diverse, strengths can build something powerful together. Now coming back to your Shark Tank India experience, we would like to know how was the experience, from preparing to pitching, and what key lessons did you take away from it? And of course, the funding experience.
I think Puneet should start this first.
ठीक. Uh, Basically, we applied for Shark Tank in the season two. The
Hmm.
season one already took place, and we were not aware about it. So we saw the season one. We saw that yes, something like this is happening. And earlier also, we might feel at his home, and we saw the Shark Tank stuff. So we were sure कि next time तो हमें apply करना ही है. So the moment the registrations were out or the nominations were out, we filled it and there was initial pitch. एक पूरा फॉर्म होता है 9-10 पेज का, पहले आप वो फिल कीजिए, उसके बाद एक आपको मॉकअप पिच करना होता है. So at that time we basically boosted all of our creative angles कि क्या कर सकते हैं जिससे उनको ये लगे कि ये कुछ अलग ही प्रोडक्ट. काफी क्रिएटिव सामने कुछ लेंसेज को लेकर के पहले कैमरा पे ब्लर किया, फिर वो ब्लर को हटाया कि ऐसा विजन आपका हो सकता है एंड दैट थिंग. लेटर ऑन दे इनवाइटेड अस फॉर क्या बोलते हैं, ऑडिशन काइंड ऑफ.
Hmm.
तो वो तीन
Camera
चार जगह
test,
पर
Puneet,
होता है.
camera test.
कैमरा टेस्ट तो तीन चार जगह पर बेसिकली वो ऑर्गेनाइज करते हैं. तो उसके अंदर उन्होंने फिर से एक पूरा पिच का मॉकअप हुआ अच्छे से, एक काइंड ऑफ आप कह सकते हो मिनी शार्क टैंक वहां पर क्रिएट किया गया. और जब वो सारा सही रहा, कुछ डॉक्यूमेंट्स वेरिफिकेशन हुई, लेटर ऑन दे इनवाइटेड अस टू देयर सेट इन मुंबई और वहां पर फिर सारा शूट हुआ. बट इट वाज गुड, इट वाज फ्रूटफुल एज वेल.
Okay.
And
So, what
I
do you think? What worked in your case? I mean, the idea, the innovation, or the story?
see,
आई
I
थिंक
think
द
the
कॉम्बिनेशन.
story, I think the story is the most important because it is what is being sold to the pan India. Like they have millions of viewers. So story and personally, me and Puneet, we prepared like it was our TED Talk moment. Like we're going for a TED Talk. We know because this platform we won't get. And yes, the more important thing that for everybody is to know your mission and know your numbers because those sharks sitting there, they can smell a doubt a mile away and they will distance yourself.
Right, right. Numbers has to be definitely correct, and your coordination. And I've heard many a time the story, works the most in Shark Tank India cases.
Yes.
Your emotional connectability.
Yeah, that's the stories that sells basically. When you're pitching, you're trying to sell your story to the world.
Right, definitely. Yes. So, after receiving funding, what immediate changes took place at CureSee in terms of, product development, team expansion, or business strategy, or maybe the marketing?
We went up from a startup sprint mode to a growth marathon. We hired sharper
Okay.
minds, added new tech layers. Now, because we knew we were like becoming, other companies will be targeting us or new things will be coming. So we added new tech layers and finally got a new coffee machine, that did.
Also, we are introducing a new product now. It is
Okay.
Site Cure. For the first time, I'm revealing it. Site Cure is the name. These are the tablets for the betterment of eye care, which
Okay.
includes lutein and all the other research components which are vital for our eye health. Those are included in a tablet form. That too plant-based. Earlier, everything is completely like nutraceutical only. They are chemical components, but we have
Mm.
included it from plant-based, and right now we are trying to scale that as well. In vision therapy, we have improvised and we have included our new version, which runs on basically any laptop or any tablet, any mobile phone as well now. So, which
Mm.
basically increases the scope that if anybody is not even having the computer or the laptop, still they can access our vision therapy solution.
See,
That's
what
fantastic.
what we found out was that people suffering from lazy eye was specially being diagnosed now since the awareness is there, were being screened and they didn't the parents or they didn't had laptop. Not every household had a laptop spare for the. So we realized tablet is the new mode as the now education, our homeworks are being done through tablet. So tablet, at least one tablet is available in each home right now, or most of the
Yes.
India I'm talking about. So we thought, why not, develop our software to each and every operating system available so that it should not be a barrier because what patients or the parents saw that 50,000 rupees laptop and then the cost of therapy.
Hmm.
So we thought, to reduce the ticket size so that it becomes more easily affordable, we thought, why not make it adaptable for the, our for the wider audience and available to the masses, I would say.
That is wonderful. A wonderful growth and strategy. I must say that's really super innovation you're having as of now. So how is QRC maintaining medical accuracy and patient trust while scaling an AI based healthcare solution? I mean,
See,
people are definitely skeptic to it also.
I think in this Puneet might add on later with the AI thing, but I think we treat the data where doctor treats the patient with care,
Okay.
with checks, with second opinions, and every algorithm is clinically validated, and we ensure empathy doesn't get lost in the coding.
Hmm.
Puneet,
हेल्थ
I
टेक
think
में
Puneet
जब
would want
तक
to add on to this.
हाँ हेल्थ टेक में जब तक कोई चीज प्रूवन ना हो या रिसर्च बेस्ड ना हो, आप मार्केट में उतरने का सोच ही नहीं सकते।
Right,
तो
right, right.
कोई भी नई इनोवेशन हमें ऐड करनी हो या फिर लेट्स से कोई भी नया फीचर हो, कोई नया प्रोडक्ट हो, फॉर दैट वी ऑलवेज कलेक्ट द एविडेंस फर्स्ट कि ये पूरा वेरीफाइड होना चाहिए और सारे लाइसेंसेस वगैरह प्लेस में, उसके बाद ही हम वो रोल आउट करते हैं। जैसे अभी मैं
Okay.
आपको नए प्रोडक्ट की बात बता रहा हूँ, साइट क्योर, इसके डेवलपमेंट के अंदर ही हमें 1.5 years लग गए, क्योंकि पहले सारे लाइसेंसिंग और वो जो गवर्नमेंट वाला एक एंगल होता है थोड़ा सा स्लो है, बट वी मेक श्योर कि पहले हम वो सब रिसीव करें, देन ओनली वी रिलीज द प्रोडक्ट।
एंड आप रूरल इंडिया में कैसे आई मीन बैलेंस और एक ट्रस्ट क्रिएट कर रहे हो? आई मीन हैव यू एक्सपैंडेड टू देयर आल्सो या भी हम अर्बन मासेस को ही केटर कर रहे हैं?
See, we believe vision care should not be about a luxury. So what we are doing, we are going where the problem is, and that lies in
Hmm.
tier 2, tier 3 cities where awareness is not there. In tier 1, awareness is there. In tier 2, so we are running awareness programs and tying up with government initiatives of hospitals where it is being provided.
Okay.
And it's since it is portable, you don't need a heavy machinery for this, just a laptop
Hmm.
or as a mobile phone. So we hope to reach interiors of India as well.
Okay, that's the great thing. So, we have many people joining us today who are, majorly students, who are having student background, who want to understand, exactly how a startup works, what is the culture, how is the work profile. So, two great visionaries are here with us today. So, we would like to understand about the work culture, about, the opportunities that CureSee is having as of now, and how should, if anyone is aspiring to be an entrepreneur, so what should be the journey, what should be the takeaway?
अमूल्य, आप करना चाहोगे, मैं बताऊँ?
I think health, we are talking about health tech ecosystem, right?
Yes, right, right.
इन
So
स्टार्टअप्स।
yeah, in startups, I think health tech needs more than medic. It needs storytellers, coders, designer, analyst, dreamers, who can solve the problem. Yeah,
Hmm.
medic is there, as Puneet said, everything has to be verified, but it is not the core. Like if you're from any background and you want to solve a problem, you can start getting, the thing sorted. And yes, medics has to be cross-checking it and validating. That is very necessary because we're dealing with somebody's health, or especially us with the vision.
Yes. So, as co-founders, how do you manage, your decisions, disagreements that align your vision during, challenging times?
Oh,
ओवर अ पिज्जा।
we me and Puneet disagree a lot, but like in a good eye vision test, we align in the end. And we actually, we have our
अल्टीमेटली वी
differences,
हैव टू
but we
सी व्हाट्स,
finally we finally resolve it, what's right for QC.
we have to see what's better
Well,
for
that
people, that we have to do.
that kind of, partnership is important for long-term success. Yeah. Disagreements has to be there. So, Dr. Puneet, as a mentor of change, what advice do you often, share with young aspiring change makers?
I think they should dream big and they should start as soon as possible. Because being a student brings you the liberty that you can start something today and you're not losing your salary or anything else. है ना, आपके ऊपर कोई डिपेंडेंट नहीं है कि आपको वो एक काम छोड़ करके ये करना है। यू कैन स्टार्ट, अगर चला तो बहुत अच्छी बात है, नहीं चला तो भी कुछ नहीं, आप कुछ सीख जाओगे जिससे इवन इन फ्यूचर अगर आप एक एम्प्लॉय भी बनोगे, स्टिल यू बी मच मच बेटर एम्प्लॉय कंपेयर टू एनीबडी एल्स जिसको अभी कुछ आइडिया नहीं
I would say start small.
है।
Start small, start now, and be stubborn about your vision. Don't wait for perfection or permission. Just if you just go with it.
हम्म।
Love that.
रास्ता अपने आप बन जाएगा. Just be stubborn on your vision. रास्ता अपने आप बनता रहेगा.
Love that. Sometimes the simplest messages are the most empowering. So what mindset, shifts did you both have observed while, moving from traditional roles in medicine and pharma to leading a startup?
I
Startup
think
is
we
all about
traded.
firefighting.
I think we traded white coats and corporate titles for hoodies and hustle.
I remember we started the thing that in we have conferences in medical field. So many of the doctors or decision makers they do come to the conferences or exhibitions, and there the majority of sale happens in B2B. So we
Mhm.
started that we'll be going with t-shirts, no more blazers, no more coats, nothing else. We are a young company, we should look young. So
So
Makes
I'll just
so
give you a
much sense.
backdrop that usually in these conferences where doctors are there, so it is very professional, and you will see people in their suits, or if not suits, at least formal shirts and ties. So, and me and Puneet hate the idea of wearing shirts. So what we did was, first of all, had the t-shirts made with CureSee logo on them, and we hired 5 or 6 people who just had the job to roam around in the exhibition, so that the CureSee vision therapy is visible. And we smuggled some of our posters, and or standees I would call them, and we waited till the conference starts, and then we started putting them at the main core area. Otherwise they would have charges in some lakhs. And once the conference started, we just very smartly placed them at the entrance. So now it is, now we don't do these things, but that time we were hustling, so we were like, why spend extra money?
Very
now
smart
everybody else is
marketing and
doing.
branding. Yeah, very smart marketing and branding strategies.
Yeah, we did this for at least 2 3 years. Sometimes where the water bottles are kept, we start keeping our small stickers over there. The bottles were complimentary, so any doctor who was picking up was seeing my name. So we did a lot of these in initial hustles, so that we have to wanted to spend less and gain maximum attention.
That is interesting. So what kind of initial challenges you have faced, while building CureSee?
Firstly, the COVID, because when we started, when we just launched in around a month, the COVID struck. Everything
Yeah.
was shut down. The lockdown was there around 2 to 3 months later. So then we thought, what else can we do sitting at our homes? So at that moment, we utilized the time into improving the software and building the next version of it. So we took
Mhm.
feedback from the doctors and the patients who already took the earlier version. And we said कि आप daily basis पर बताओ जो भी minor से minor आपको issue आ रहा हो, we'll rectify them. तो उन सबको include करते हुए by the time COVID ended, we were like ready with the new version of it.
I'll say convincing doctors that vision therapy could be digital felt like convincing aunties that WhatsApp isn't medical journal. So we came up with
Anyway.
data, determination, and hundreds of demos. I remember, like, in the starting, with AIMS, All India Medical Institute, we gave them, I don't know how many free patients to their research.
Around 500.
500 patients. We did complimentary because we knew that this works. And in the end, when AIMS came up with their research and they published it in the Canada Journal, it was from there, it was a cakewalk for us, because we don't need to show, tell doctor, convince anything. We just need to show
Mhm.
two journals and FDA approval. And now it is quite easy for our sales team. But initially, when we were doing it ourselves, like I was doing, so I don't know, hundred thousands of demos I've given.
Mhm. So real. And I think every, struggling or a starting entrepreneur can relate to this phase of struggle. So how can, students from medical backgrounds contribute, to health tech ecosystem meaningfully?
From non-medical background, right?
Yeah.
We always require such people, be it in engineering, be it in designing and either marketing or HR. These people are always required in all the health tech companies, right? But in startups, it's all about growth and firefighting on a daily basis. So if it's somebody who's looking for internship, we are open. Somebody who's looking for work, then also we are open. They can reach out via either LinkedIn or WhatsApp or any mode, and then we'll be able to assess and then offer them something.
Yeah, if you can solve problems and ask better questions, you're already halfway in CureSee.
Yes.
I think only half of our team is clinical. Rest are those people only engineers, developers.
Engineers, developers, marketing people, HR. So, guys, you can have a note on this, and there is a lot of opportunity. You can definitely reach to both of them. They're available on the LinkedIn. I will share the links with you after the session, definitely. So, while hiring, any young or fresh talent, what key skills or, attributes you look for, beyond their academic qualifications?
How skilled are they? Or how well can they communicate? If it's a role requiring communication with patients, then how well can they communicate? Those are the two
Hmm.
major aspects that we look for. Then only I take a look at the qualifications or what all he or she has done.
I'll just put it, if you have curiosity, humility, and ability to Google well, and you're obsessed with learning and allergic to medrosity, you will fit exactly very well in the CureSee team.
This gold straight from a founder's perspective and super relevant for the students joining us today. So, with the pressures of running a fast growing health tech company, how do you both manage stress and protect your own mental health?
We go on trips together. Majorly, we don't get much time to either meditate or do something else, but we manage to, meet each other and then have some moments where we are grateful that we have like each other backing for no matter what happens in the company. So that keeps us motivated, and also every phone call that we share at that moment, we know that yes, we are building something which is great for the community, and we're always
Mhm.
developing something new. In past 4 to 5 years, there's never been a moment that we are just stuck on something and we are just selling it. We were always developing something new. Right now, also, this new product is there. So that is from my end. Can you add on anything else?
Yeah, I think sometimes we let the servers take care of themselves. No, I
That's
think
important.
yeah. So sometimes we just unplug, but otherwise, the environment that we have at CureSee is not as a corporate. It is very fun loving, and our interns don't only don't fetch coffees for us. They are basically innovating, trying, and failing. So even like some people, like, they can find out the fresh minds. I see they see clearer or better. So there's some things which me and Puneet might have missed, or the some feature we didn't think was required. But when they are sitting on it and they find out that, okay, this will be helpful for the patient benefit or a doctor benefit, then they talk to us, that we tell them to develop. So it is always something new is going on. So I personally have not felt that pressure of something. It was just before the Shark Tank that last time I felt pressure while working in QC, that it should go well.
That's great. That's great. So, what is your long-term vision for CureSee and what impact do you hope to create in the world in next 5 to 10 years?
We want to make lazy eye a history. From 10 years from now, when parents should laugh at the idea that patching didn't QC already solve it. So if that is done, I think we did our job well.
This is truly inspiring for all of us. So, the
And
house
as
is open
Puneet,
to questions.
yeah, and as
Yeah,
Puneet mentioned that, I didn't wanted him to mention the site cure here on the platform, that because there were teaser videos coming in. So, but like, we innovate, and we want to do well in health, in eye care industry. So right now, CureSee is, as our vision therapy software is the best in the world right now. So we're coming up with eye care supplementations, which would help in eye fatigue, because in modern day, what we feel, the screeners have become bigger and have come closer to our eyes, causing eye tiredness. So we are trying to resolve that problem also, and in a herbal way, not with pushing something in more proven. And that's what Puneet said, like 1.5 years of only trials and trials and trials and patent filing, so that what we are creating is like a legacy to continue,
mhm.
to continue.
That is wonderful. Wonderful mission, I must say. So the house is open to questions, and we're having some of the questions in the chat box. So I'll pick up the questions and you can definitely give the answers. So Jitendra Seni is asking, "Hello, sir. What was going through your mind while pitching CureSee on Shark Tank? Any moments that really stood out?"
I like I mentioned, like a TEDx talk, cameras were rolling, and I think after few
That
seconds,
super filmy
I
feeling.
yeah, I after few seconds, I totally forgot who's on my right, who's on my left. But if you guys go back and see the pitch, it is going so perfect. Because we were nervous for initially, I guess, for 15-20 seconds, but the moment everything changed when we realized that we are in here, where the camera started rolling and we realized, oh, this is our the moment. That because it's like once in a lifetime, you get to stand there and pitch it to I because I didn't see that I'm pitching it to four or five experts there. What I felt was I was pitching it to entire India, and it turned out that we went international after that because it was watched internationally. So we got a lot of connections and calls and inquiries that they wanted to enroll in their country as well.
That must be a wow moment.
Yes.
Also, everybody else was getting bullied there. So हमारे दिमाग में कि ये भी चल रहा था कि हमारे साथ क्या होगा.
हाँ वो भी मैंने सुना है गेस्ट आई मीन
हाँ
द
but
शार्क्स थोड़ा करते हैं
हाँ
Yeah,
but that is
Puneet
the
ग्रिलिंग
second
was.
एंड
season.
Yeah, Puneet was just standing right next to the place where you done with your pitch. You come out to a green room or a place. So he was there asking, how did it go? What was I mean people who went ahead of us, two teams. They got like really really hammered. So that's why I said for 15-20 seconds we were like, what, I don't know what gonna happen. But after 15 seconds, some energy came in, and I think we walked through the complete episode
Also,
like a charm.
let me tell everybody that it's not scripted at all. Only the first liner, so the pitch, that one liner thing, that is only scripted. What we have to present, what QC does in the simplified Hindi manner, right? Because everybody from the tier two, tier three cities are also watching. That thing is
Puneet,
only scripted.
it's not more like a scripting. It's basically they polish your pitch. Basically, when we say that I am
Transform
this and
it
this,
to
so
a
to a
common
better. So they have
like.
content writers, right? So
Hmm.
your story meets the content writer, and they try to make it a sellable story.
Right. Just all the questions and all the answers that were like just random only. We even didn't knew what we are going to speak. But there
no
was one
shaking
thing
moment.
that if like there was one insight that if you crack the deal with any even the single of shark, then obviously that episode will get aired. Otherwise, there's a probability it might get aired, it might not, based on how well they think, how entertaining or how TRP gaining it is. So our main motto was to get the deal. And later on, we saw that two sharks were fighting for us. So that was the moment
Yeah,
for
but you chose well, Lenskart. That was a good decision, I must say. So the next question is, so what sparked your interest in optometry and starting something like CureSee? Was there a personal story behind it?
optometry by accident. Uh, I even didn't knew about optometry. I went into the college to fill the form of admission, and there were two choices. First was audiometry. Second one was this optometry. So mistakenly, I had chosen the optometry as one and the audiometry as second, and now I'm very grateful for that. And secondly,
Yeah.
about CureSee, हमारा जो third co-founder है जतिन कौशिक, he's also the tech head. So basically, उसके cousin को employ किया था. Just to cure him, we started as a basic project कि उसको अगर हम कुछ help कर पाए. Once he get cured, then we said कि we can commercialize this thing.
He
Okay,
was our
okay.
first
That's
test patient.
interesting.
He was our first test patient.
First question.
Or you can say the QC was developed around him. So that we know that, if we are able to solve him, then we are open for the world.
Yeah, that's really interesting, in
But
fact.
but but let me tell you, it still took us more than 500, 700 patients to get corrected. And then only, we could launch it for the doctors or the public.
Yeah,
That was a
long way.
self-aggression when Puneet
Mm,
told me कि ये चलेगा.
right. Nice. This is inspiring. So the next question is from
I
Rajni
think
Singh. Hello,
it's the
sir. What?
same only.
Same. Yeah, yeah, same. Okay, so we have answered the question. So, guys, if you're having any more questions, you can just share with me. I will route it to their profiles, and you can get it answered by later on also. Uh, So that's all from my side. I think we're good to go now. So thank you so much to both of you for walking us through your transformative journey from identifying a real healthcare gap to building a scalable AI powered solution that's changing life. Your story is a proof that true innovation comes when empathy meets action and when knowledge is shared across boundaries clinical, technological, and entrepreneurial. To all the students watching, take this as your cue. You don't need to wait to become a change maker. Start with what you have, where you are, learn, build, collaborate, and most importantly, take action. At Whiteboard Foundation, we are committed to supporting your journey through free upskilling, webinars, expert mentorship, and real internship opportunities as part of our mission to build a Viksit Bharat by 2047. Once again, thank you so much to both our inspiring guests, and a big thank you to each one of you for joining us today. Let's keep the change maker spirit alive. Let's keep building the future together. Thank you so much to both of you.
Thank
Thank
you.
you.
Thanks
Thank you
for
very
having
much.
us. And thanks to everybody for joining in.